complaints to unrelated to COVID-19.
It says complaints related to exploitative practices relating to the virus will be handled by dedicated teams for both the Competition Commission and the National Consumer Commission.
They've already received more than 20 complaints of excessive pricing of things like face masks, toilet paper, sanitary towels. Consumers and others affected businesses can report concerns via the Consumer Commission's website or on this toll-free number that is 0800 014 880. That number again, 0800 014 880.
So for complaints to the Competition Commission, you can phone or WhatsApp Shadrach Rambau on 084 743 0000. Shadrach Rambau, 084 743 0000. That's from tomorrow.
Tuberculosis remains the world's deadliest infectious disease, claiming 4,000 lives every day. In 2018, 63,000 South Africans died from TB, many of them already infected with HIV. Today, on World TB Day, as we grapple with the novel coronavirus, experts warn that patients with underlying conditions like TB and HIV are at high risk. Doctors Without Borders is urging international funders to make resources available to contain the spread of the virus. Tom Ellman, the head of the Southern African Medical Unit, now joins us via Skype. Good evening and welcome to The Full View. What should the response be from all stakeholders, including governments?
We're facing an unprecedented global health emergency, and we have a few weeks now to learn the lessons from Europe. We have seen Europe is a few weeks ahead of us in their response. There has been too much complacency in Europe, and now we have Southern Africa and the rest of Africa facing this crisis with many vulnerable people, particularly, as you mentioned, many people with tuberculosis and with HIV who are at high risk of severe disease with COVID. We need to ensure that the countries are ready, the populations are ready, not to panic, but to take this very seriously. And it's good to see that the government is doing that. But most importantly, we need to get the messages, the very simple messages about how to reduce your risk of getting coronavirus across in all communities to protect the vulnerable populations.
The difficulty that some medical practitioners have spoken about is that when you try to compare Europe and try to compare it to Africa, for instance, South Africa in this regard, that we have, for instance, HIV as well as TB cases, which was mentioned yesterday by the president as well, that it could lead to a catastrophe. But in Europe, they are not really dealing with issues such as HIV as well as TB as much as Sub-Saharan Africa is dealing with. So how do we make sure that there are clinical tests to prove indeed whether any trial tests are being run at the moment would be able to assist those people with underlying conditions?
Yeah, it's very important that the experiences of Europe we don't assume are going to immediately translate to the populations in Southern Africa. We do need to be very aware of the vulnerabilities of the populations and push hard to ensure, on the one hand, that whatever people in Europe and America are having access to is made available to people here, but also to make sure that we are adapting the approaches that are being taken for these populations. It's easy for some people to stay at home and to be physically isolated. We're saying physically separated, but socially in solidarity. If they're living in townships, if they have to go to work in crowded taxis. The issues specific to HIV, TB are maybe not as different as the issues for elderly populations. The vulnerabilities are the same for everyone. We don't know enough yet about how HIV relates. Certainly in people with advanced HIV, that's a poor immune system, who are not on antiretrovirals, who are not taking their antiretrovirals regularly, they need to get back onto treatment urgently. Same for people with tuberculosis. But people who are stable, people whose viral loads are undetectable, it may well be that they don't have much of a different risk to the general population. Right now, we just don't know. So the most important thing is to ensure the same messages, that people maintain physical distance, that everybody follows the simple messages from the government and from WHO. And with that, we keep safe. In addition, of course, people with HIV and TB are regularly needing to go to health facilities to get their drugs. But going to a health facility is a risk. Firstly, because you are at risk of getting the virus at the health facility, but also because if we overload our health facilities, as is happening in Europe, then the health workers are not going to be able to have the time either to care well for people with coronavirus or other diseases. And we saw with, for example, the Ebola outbreak in West Africa that more people died from other diseases because the health system couldn't cope than died from the virus itself.
Yeah. Tom, with that said, and we've heard from the WHO as well, that testing is very important. Do you think that the strategy around testing should then be different, where there is also a focus around people with these underlying conditions, including TB and HIV, because at least we know where these patients live?
Well, at one level, you're right. The experience of working with communities, activists, counsellors on HIV means that there is more preparation in some ways than in Europe. We know the communities. They have been involved in fighting a virus, the AIDS virus, for the last 20 years and more. And we need to take advantage of the capacity to capitalize on that experience.
Okay, thank you so much. Tom Ellman, the head of the Southern African Medical Unit, who joined us there via Skype to speak about World TB Day, but also how the world should be responding to people with underlying conditions.